Hi there, I'm Mark Scholl. I'm an orthopedic surgeon. Today we're going to talk a little bit about the rotator cuff. We're going to talk a little bit about function, we'll talk a little bit about injury. So the rotator cuff is a group of four muscles that connect the ball and socket in the shoulder. I'm a little bit of a visual learner, so when I'm talking with patients about the rotator cuff, I really like incorporating models so that I can help people understand the actual structure of what we're describing. When we look at a model of the right shoulder, so kind of sits in the body like this, we've got the collarbone up in front, we've got the shoulder blade around and back. We can see that we have one muscle partially represented on my model coming from the shoulder blade. That's the supraspinatus, one of the four rotator cuff muscles. Rotator cuff muscles cross over across the joint space, become tendons, tendons attached to bone. This forms an enveloping cuff of tissue that surrounds the ball and socket, helps to stabilize it, and helps to move the shoulder. The main rotator cuff is up top. And this is why when we talk about the rotator cuff, sometimes it can be misleading because the function of the supraspinatus up top, when this muscle contracts and pulls around the center of rotation of the shoulder, it actually elevates or reaches the shoulder up. This is why sometimes we say the rotator cuff probably should have been named the reaching cuff, because that reaching motion where you're putting your arm up overhead is really critical function of the main rotator cuff tendons. So injury to the rotator cuff tends to start at the very leading edge of the supraspinatus. That's towards the front of that tendon where it attaches on the bone. And when we're talking about tears of the rotator cuff, we're usually talking about where that tendon starts to tear away from the bone. The high forces on the arm that pull on that tendinous attachment to help us lift our arm and move and throw baseballs and do things that are functional will get a lot of stress through the activities of life, and sometimes sudden stress with an injury. Injury to the supraspinatus is the most common injury that we get in the rotator cuff group of muscles and tendons. The supraspinatus receives the most heavy demand of any of the muscles in the rotator cuff. Once that attachment releases, it gets easier and easier to unzip the rest of the tendinous attachments. That's why small tears become medium tears. That's why medium tears become large tears. And we like to get to our rotator cuff injuries when they're smaller because it just makes sense that we have higher success rate fixing smaller tears than we do fixing larger tears. And that's a brief overview of the rotator cuff in the shoulder. If you look at some of my other videos, we take a look at once we get an injury to the rotator cuff where that tendon is torn away from the bone, how we repair that, how we get that back in place so that it can heal properly and get people back comfortable and enjoying the functions of life.